Hey, future nurses, welcome back to another simple nursing mini lesson. Today we're diving into nursing process fundamentals, aka ADPIE. This is one of the most important frameworks that you'll ever use in nursing school, clinicals, and throughout your entire nursing career. Now, before we dive in, we have a bunch of free resources specifically for you, like our nursing process study guide and a downloadable nursing care plan template with examples. You can grab them by simply using the link in the description or the pinned comment below. Now, let's break this down so it sticks with you. Think of nursing process as your game plan for patient care. It's a 5-step systematic method that we use to assess and respond to our patients' needs. And yes, it's literally how your NCLEX questions are structured. Remember it with this simple acronym, ADPIE. A is for assessment, D is for diagnosis, P is for planning, I is for intervention, and E is for evaluation. Now, some schools or textbooks include a 6th step like outcome identification, so we can turn it into ADPIE, simply adding an O. But we'll include that in the planning section since they often go hand in hand. All right, so let's dive into the details. Step number 1 is assessment. This is where everything starts. In this phase, you're gathering all your data, objective and subjective. Think headed-to assessment, vital signs, lab values, patient history, what the patient says, and what you see, both subjective and objective, and chart reviews, as well as input from the family or caregivers. Now, here's a key tip. Don't just rely on machines. Always assess the patient, not just the monitor. This is where critical thinking starts. You're connecting the dots between symptoms, signs, and potential issues. Now, step number 2 is all about diagnosis. Nursing diagnosis, not medical diagnosis. Now, as nurses, we're not allowed to diagnose pneumonia or even diabetes. That's for the provider. Rather, we identify how the patient is responding to those conditions. That is our domain and scope of practice. So, for example, a medical diagnosis is a stroke. A nursing diagnosis is impaired mobility or impaired swallowing related to that stroke. Another example is a medical diagnosis of asthma. A nursing diagnosis is ineffective airway clearance or anxiety related to that asthma. So always use NAMDA-approved language when possible. It's standardized and what your professors and NCLEX are ultimately looking for. Step 3 is about planning. This is where you create goals for your patient. So always think SMART goals. S is for specific, M is for measurable, A is for attainable, R is for realistic, and T is for timely. A good example of a SMART goal is the patient will maintain an O2 saturation of 95% within 24 hours. A not so great example is the nurse will monitor patient breathing. That one is way too vague and nurse focused, not patient focused. So quick pro tip, planning often includes outcome identification. So always be clear on what success actually looks like for your patient. Step number 4 is all about intervention. This is time to act. Interventions are nursing actions that you take to achieve the goals. For example, administering medications, teaching breathing techniques, repositioning the patient, even collaborating with other specialties like PT, OT, and SLP. You're implementing your plan, but always base it on the earlier steps. Don't skip straight to action without a foundation. Step 5 is all about evaluation. How did we do? Did the intervention meet the goals? Is the patient getting better or are they getting worse? So if they're getting better, then great, document it and continue monitoring. If not, then go back to step 1. Nursing process is cyclical, not linear. You're constantly reassessing and adjusting care based on your patient's response. This loop of care is what makes nursing so valuable in patient outcomes. So you'll use ADPIE consistently in clinicals, even if you don't realize it. You'll always be assessing, prioritizing a nursing problem, planning your response, doing the thing, and then checking the results. Over and over again, kind of like muscle memory. The sooner you master this process, the faster your critical thinking will grow. And yes, you'll crush all those test questions that say, what is the nurse's next action? Or what does the nurse do first? So if you want a shortcut, Download our free nursing process study guide and care plan template. They're linked right here below. Use them to practice writing real care plans just like you'll do in clinicals. And if you're ready for more, our Simple Nursing membership includes detailed videos, practice questions, and real-world examples of nursing process, nursing diagnosis, as well as care plans. You've got this, future nurse. The nursing process is your framework for success, and the more you practice it, the more confidence and competent you'll feel on the floor and in your exams. If this mini lesson helped, then give it a like and drop a comment with your biggest takeaways. And don't forget to subscribe and share with a friend so you don't miss the next video. And always remember, at Simple Nursing, we make nursing knowledge that sticks. Catch you guys in the next lesson.